Good afternoon, everyone. Thank you for being here. Hopefully everybody's been enjoying some of the nice weather in central New York. Going to get into some information related to cases and how we're doing with the virus. Then we can take some questions related to restart. We have lost one neighbor since yesterday over the last 24 hours. African-American man in his 80s. We now have lost 161 of our neighbors in this process since March 16th. Certainly, we want to think about everybody, think about their loved ones as they're grieving. As we move on in the process, hopefully they'll be able to grieve together. But certainly this virus has been brutal to our country and our state, and we've handled it well, but it's still not us around. So please keep everybody in your thoughts and prayers moving forward who've been impacted by this virus. Looking at testing, we have now tested there's 47,129 tests that have been completed. Certainly, there's a little bit of a gap. Some people are getting tested twice a week in nursing homes. The employees moving forward with the governor's executive order. I think that was a wise executive order by the governor. Once a week works. But we're almost to the point where the number of people are, essentially that 10% mark of the population, which is important when we're trying to find these pockets of the virus in the community. 46,352 tests have been returned. 1,022 have been returned since yesterday. There are 2,351 positive cases since March 16th. 15 new cases over the last 24 hours. And we've had 44,001 negative results to date. We sent in 993 tests since yesterday. We have 777 pending tests. Our infection rate since March is now at 5.1%. Continues to go down. We expect that number will continue to go down with universal testing. What is really good news related to our testing over the last 3 days, we take all of the tests off of the state eClair system, and so we know how many tests got processed through in our county. We then take the positives. Our 3-day infection rate is now at 0.8%, under 1%. Certainly very, very happy with that as that continues to go down and we continue to make progress. Certainly the Syracuse Community Health Center, universal testing site, and our mobile testing sites this week. Today we have been at the Solvay Community Center, Woods Road in Solvay. Certainly there's still time. I believe it's open until 5. Yesterday we were at Grant Middle School. The day before we were in Skaneateles in our western towns. Tomorrow we will be at Blessed Sacrament Church in Eastwood. And on Friday, I will give the schedule of all the other sites for mobile testing for next week. I know we will be certainly out throughout the region next week as well. Looking at our regional testing data, 775 is our daily number. We had 2,105 tests between all Onondaga County and all of our partners in Cortland, Cayuga, Madison, and Oswego counties as well. Again, that's not an issue. This was a metric for restart that we built up the testing infrastructure. We've been meeting this number quite easily. And it's going to be important as we move on in this process that we continue to proactively test, especially when there's more density together and in the fall, specifically when the fear of a second rebound with this virus could potentially be there. So we will keep this robust testing infrastructure in place moving forward as well. Looking at hospitalizations, 57 individuals in the hospital. That's down There's at least half still waiting for to test negative to be released back into a nursing home. These are folks who have been in the hospital because they were sick. They've gotten better. There's an executive order that only allows them to go back to their home. In this case, they live in nursing homes. And when they test negative for a COVID-19 test. We put together a couple different facilities that the state is working through their process on approving, where these folks could come out of our hospital numbers and they could be in a transitional facility until they're ready to go home. But in the meantime, while we're waiting for those approvals, some individuals have been testing negative. So those folks get to go home. So that is good. Our hospital numbers are really strong. And our infrastructure, our medical infrastructure is doing great. So I want to thank all of our partners and all of our responders and all of our healthcare workers who have really done a phenomenal job. Looking at ICU, we have 12 of our neighbors in the ICU. These are folks who are in a real fight right now. That's down from yesterday. Certainly, we've seen a range, over the last month, 13 to 20 individuals in the ICU. 12's on the lower end of that. Let's hope that's a trend that we continue to see. As once you're in an ICU, you're in a real fight. So please keep these folks in your thoughts and prayers. Looking at who is still in the hospital, 36 Caucasian, 15 African American, 2 Asian, 1 is of another unidentified race. 3 have declined to share demographics. To date, we've had 303 people who have been released from hospitals. They went into the hospital, they were sick, they got better, they went home. When we look at our 15 positive cases, 3 are household contacts of previously confirmed cases. 7 are related to senior living facilities. 5 are community spread. So when we look at our community spread numbers, 7-day average under 6. Phenomenal progress. So let's hope we can keep that up. Looking at active cases, 910 active cases, down 19 since yesterday. Looking at recoveries, 1,285 recoveries, up 33 since yesterday. Asymptomatic, out of our new cases, 33% of our new cases have been asymptomatic. Folks who get tested either because they have to by executive order as an employee, or folks that are just curious. And so a third, really interesting data there. When we look at who has been impacted by the virus since March 16th, 1,405 of our cases have been female, 946 have been male, 118 are under 19, 385 in their 20s, 313 in their 30s, 282 in their 40s, 365 in their 50s, 295 in their 60s, 239 in their 70s, 216 in their 80s, 138 in their 90s. When we look at where folks live, again, the first number are the total number of cases in the community since March 16th. The second number are recoveries. So the city of Syracuse, 1,334 with 678 recoveries. Town of Clay, 180 with 122 recoveries. Town of Onondaga, 137 with 50 recoveries. Town of Geddes, 138 with 36 recoveries. Town of Salina, 102 with 68 recoveries. Town of DeWitt, 85 with 58 recoveries. Town of Manlius, 81 with 63 recoveries. Town of Camillus, 71 with 45 recoveries. Town of Cicero, 72 with 48 recoveries. Town of Lysander, 41 with 38 recoveries. Town of Van Buren, 30 and 15 recoveries. Town of Pompey, 27 with 23 recoveries. Town of Skaneateles, 15 and 15 recoveries. Town of Lafayette, 9 with 4 recoveries. Town of Marcellus, 9 with 7 recoveries. Elbridge, 5 with 3 recoveries. Town of Atisco, 5 and 5 recoveries. Town of Tully, 4 and 2 recoveries. Town of Fabius, 3 and 2 recoveries. And Town of Spafford, 3 with 3 recoveries. Restart, we are very close to phase 3. Excited about that. Hopefully we'll be getting some news from the governor on this very soon. But the data is stronger in phase 2 than it was in phase 1, which was stronger than before phase 1. So we don't anticipate any hiccups. The governor and his team are now going through their process. So excited for the weekend, as we anticipate phase 3 will be at some point over the weekend. And we can take more questions on restart, but related to, certainly we want to remind people, we created a daycare program for essential employees. We still have that program available through the month of June. Child Care Solutions, 315-446-1220. Please reach out to them if you have a gap in child care through the month of June. Other than that, we'll take some questions. I think we're making progress on that, Michelle. We've made our position really clear. I think the state's looking at it. I know other county executives across the state need their facilities to be open. When you look at where we are with this virus, we're in a position where it's not really a public health threat at this point to have it open. These facilities need to be cleaned. They understand the cleaning protocols, mask wearing. So I believe we're making progress, and I'm confident that hopefully we'll get an announcement on that in the near future.
Have you been given any kind of guarantee from the leaders on your regional call, the state leaders, that the governor will give advance notice of a phase 3 designation?
No guarantees in life, Andrew. Certainly we anticipate, we know that our data is being reviewed and has been being reviewed already. So certainly we are encouraging the governor. I know a lot of restaurants would love to be open Friday night and be able to plan for that. So we've been encouraging, if the data is reviewed earlier, that certainly great opportunity to get some of these restaurants busy. And to give everybody an idea, restaurants in Onondaga County, number 2 producer of sales tax, number 2.
Do you feel the state is further ahead where we were in phase 2 the days before?
Yes.
I remember, yeah, because I remember the night of kind of the drama, you were told around midnight, the state is reviewing your data. Now you're being told that already.
Yes, and guidance has already been given out to many of the industries. I think the state's looking at, can they, is there maybe a more robust phase 3? I think they're looking at that. I think the control room process in the last week has worked better as far as input that we're giving being digested, and some of those recommendations certainly have been put into place. When you look at the outdoor seating, when you look at churches, those don't happen by accident. You've heard people talking about those for a period of time, and certainly that's a process of feedback and communication, and then the state executing to their credit.
Have you given some guidance yet on youth sports? We have a softball, baseball coach who says he can start taking names on July 1st, and he has some guidance from you.
We've asked for specific guidance. Right now, we're very comfortable to say that you can have a practice with 10 and under on a field, and so that gives you the ability to have this, have some sort of games, but specifically to some of these leagues that want to get going, they want more concrete guidance from that. So that's been part of our calls. I know across the state too, others are anxiously awaiting that. But I think we're at the point now where certainly there's a way, whether it's softball or baseball, soccer, that you can start to do these things. And we need to start communicating these things. So I anticipate, again, this is one of the things that's been talked about all week, that we'll probably see something in the immediate future.
So right now you can practice with 10 people?
Yeah, I'm very comfortable saying that you are allowed gatherings of 10 people, that you can have a gathering of 10 people and under if you're a team for a practice. I'm very comfortable giving that guidance.
And that's for only certain sports?
I think that falls under many different categories related to gatherings. I'm comfortable with that, and specifically to leagues, I think that's a little different with how the interactions work there. I think we should wait for state guidance on that, which I believe is forthcoming. You know what, I selfishly haven't really paid much attention to the other libraries because we have our own, and we've been under our own, again, falls under our, it's a department of ours, so we're going to operate the way we will. We'll probably expand our services. Right now we've been doing our curbside appointment only. We'll probably expand services in the next week or so into our next phase ourselves, but I can look to see what, not all the libraries in the library system fall under our situation. A couple of them do, others don't, but I can look to see what the guidance is on that. I just haven't paid much attention to that. Yeah, there was conflicting reports on that from the WHO. I read it the same way you did, and then someone told me maybe later on they kind of tried to move backwards a little bit. Maybe they got ahead of their skis a little bit. And so we treat an asymptomatic case just like you would be as if you're symptomatic. We're presuming that they are as infectious, so they'll go through an isolation period. And then if they can go the 10 days without, if you're under 65, 10 days without any symptoms, no temperature, then you'll be released as recovered. But that's one of these things that until science tells us we can act differently with these folks, then we will. And again, we're getting some asymptomatic employees in nursing homes. We're getting asymptomatic residents of nursing home, asymptomatic members of the community at large. So it's really an interesting trend that we hope to learn more about. Yeah, we've expanded the testing, so you're getting these pockets, and I think what you're seeing is you're having people that have some sort of, over a period of time, they had some sort of impact with the virus, not a large impact, and it kind of hangs on, and we'll hopefully know more about that as science continues to make strides with the virus.
If robust testing is so available, why don't you require these people to get tested at the end of those 10 days to make sure that they don't still have the virus asymptomatically before they go back to work or whatever? I'm
not going to make those requirements. We'll leave the CDC and the health professionals to make those requirements. If the doctors decide that's what we need to do, we'll do that. But right now they haven't done that yet.
Are you getting any indication from the state that Phase 3 might include additional industries than the original Phase 3 on paper?
Yeah, I think we've had good communication. I'm pleased with the calls we've had and the communication back and forth about their listening. And I think you've heard in the governor's, comments is that, the state overall is doing much better than where they probably thought they'd be right now as well. So certain things, even in New York City reopening, elective surgeries are open right now, where we kind of got those in, different timing, and some regions got them in Phase 2. So I think what you see, and I give credit to the state, is when you can do things safely, you got to be able to pivot and do that. And I think you're starting to see that right now. And so I think this, that's, smart.
Have you had a conversation with Dr. Gupta? What the virus seems to be handling the added capacity that we're giving it through Phase 2 and Phase 3, not Phase 3, Phase 1 and Phase 2. We're not at Phase 3. What does she attribute that to? I mean, are we feeling that this is naturally going away, or is masks really to credit for it? Any indication on what to give credit to?
I'll ask her that question specifically. I don't want to put words in her mouth. But I think it's, an all of the above type answer. You have a pretty robust testing and tracing system so that when you find your symptomatic case, you're getting any of the contacts there, and that has a lot to do with it. I think for a while in our community, we had, even though there was days where we'd have 40, 50, 60 cases, when they're facility driven, that skews the data a little bit as far as the macro picture. At the micro level, facility cases are very bad because that's going to drive your hospitalizations, and those are our people we can least afford to have this. But overall, I think you have people, we know more about the virus. We have better infrastructure so we can react quicker. People have really done a nice job. I think masks help. And the weather may be an impact as well. I think so. When you put it all together, I think there's quite a few things that are driving success now.
How quickly are the tests being returned?
Pretty quick. Certainly, we've read about some of the twice a week testing in nursing homes with employees. Depending on the lab that they're using, that might be an issue. What we did in our county is we teamed up nursing homes with various labs. So you don't have one lab doing all the nursing homes. We had one lab for these 3, another lab for these 4, et cetera. And that has helped with the turn times. But overall, again, I know we were getting some results within 24 hours. Some were not, but certainly we have not seen the case. We brought in enough labs into our infrastructure, so we're not waiting 3-4 days for most cases. Like everything, there may be an example where we are, but for the most part, we're seeing pretty quick turn times.
Are you eliminating that lag on getting active cases to recovered cases? How's that going?
So my understanding, because I want to give you all this information specifically, is that the nursing home, the nursing home cases related to residents, that the state may not label them recovered right now. So we're getting specifically how many, we're going to separate out those data points because if they're never going to be recovered until the state deems that they're changing their rule, it's not really a fair reflection of the recoveries. So we're going to break out, our health department's working on breaking out those numbers, and that way I think that will show you really how facility-driven this problem was in our community for an extended period of time.
Why is the state not labeling them as recovered?
I think because of the fact that they're being very conservative because of the impact the virus has on these residents. Yeah, I mean, I put the 2 sites together. I'm not going to specifically call them out because I don't want to have them done, but we put those in front of the state when this problem happened 2-3 weeks ago. I know they're working through approval at least on one of them. The second one probably not as important right now, but moving in, if there's spikes or if we go into the fall and this comes back, certainly then you're going to need that ready. So certainly we want to see one of these approved. But the data suggests that some of these folks now are starting to test negative after being in this transition period for 2-3 weeks. So we'll see if that continues. But certainly we think we need at least one of these approved now, and then certainly 2 of them would be good. And so we're ready moving forward in case there's new spikes.
Might that problem resolve itself? I know you mentioned the problem is resolving itself.
Yeah.
Might it be totally resolved by the time the state approves your proposal?
It could, and that's what. So originally we thought we needed 2 because we had such a a backlog of residents who were in this position. Now we probably only need one, if really needing one. By the time we get the green light, maybe we don't really need any of them, but having that with those approvals is important because we need that infrastructure in place. The rule that the governor's put forward is smart, and so we know that we need that there to take part in that process moving forward, because we know if certainly if this virus at any point in the future gets into a senior facility, that we're going to end up with hospitalizations. We know these things. Yep. Yeah, I think the information and the feedback going back and forth is better, and there's more of a, I think, willingness to lean on some of the local officials related to this. And this has never been done before, especially nobody's ever had to restart an economy, a 101-year pandemic. I think if you remember where we were during recovery of this, and it seems like years ago, but we would come up every day and talk about the things we were doing, and that was your county government doing these things. That was your hospitals, those were your health department workers, that was our team. Where the state would come in is when we had a gap and we would ask them for help. Meanwhile, the state government was focused in on ground zero in this fight in New York State and Westchester and New York City and Long Island. So they were doing the same heavy lifting there that we were doing here. So I think through this process, as they learn more about how things were going in the other regions, they're more comfortable and more confident with the decisions and the messages that we're channeling up. So that has led to more success, I think, between phase 2 and phase 3. Yeah, there's more trust. We've been working together in a different way longer, and certainly, we know what we're doing with this. Dr. Gupta's team, really good at what they do. So I think that has helped, and certainly, again, the last week and a half have been really good, and I think we'll have a stronger process for phase 3 going into phase 4, and then really that's when you really have to work as a team, because after we get through this, you have to, hopefully we're preparing for what could happen in the fall, because we've knocked this virus out for a period of time, and then you need to focus in on putting people back to work, some systemic changes related to poverty, things that we're all going to have to work together on even more moving forward. So we really need to get through this process stronger and trusting each other more, so that we can deal with the aftermath of COVID-19 round 1.
Have you tested the residents at the jail and the Justice Center?
We did start testing Justice Center inmates this week. We had to work out, there's an insurance issue there, because the average time period at the Justice Center is under 30 days. So making sure that Medicaid would cover those was a little bit of a delay, plus some of the protests also delayed some of that testing, but that has started this week. Well, we have another, so our sales tax payments are always delayed a little. We have, I believe, 3 more payments in June. I get the sense it's a little bit better too. I got a couple car dealers sending me their year-over-year numbers from the month of May. I want to get more to look at it, but you're looking at 25 to 30% deductions in the economy in May, so that's actually a little bit better than 35%, 37% in sales tax. But again, restaurants being number 2, we've had these restaurants sidelined. They've been at 50%, maybe 60% capacity. There's some segments of the economy that do quite well during this pandemic and are doing extremely well. There's others that are sitting around on the sidelines. So that's why we talk about, in desperation, getting retail going, getting these small businesses going in Great Northern and Destiny so that they can start making money. These folks don't have any money. They're spending their savings and they're desperate. So these are all things that as we get into phase 3, certainly we think from that point forward, we'll get a good idea on what the economy recession, because the economy's technically in a recession at this point, what that means to overall consumer spending, which then gives you the ability to forecast out. But we expect our revenues to go at least down at least 20% before they start making any comebacks. 20% total. Right now they're down 12. So we're expecting that they at least go down 20, and then maybe we can crawl our way back to somewhere better than negative 20. That's our hope. Yeah. So the second part was nonprofits with, what was that? Yeah. So we're not going to, all budget lines in our budget got cut. Nonprofits, 15%. I'm not going to look my workforce in the eye with my mandated service and say, I'm going to let go of you, but have not touch any of the non-mandated services. So when you look at every department in county government has been hit, including the sheriff's department. The defund police movement, I hear about it, and I hear politicians talk about it, and I've gotten some emails about it, but nobody's been able to answer the question to me, when you call 911 because you need them, who does my 911 dispatch? Who do they call? Or does the system not work anymore? So there's a lot of rhetoric on that. If you're in a position where you don't need money in a department and you can invest that in people, I think that's very good. If you look at what we did with the early childhood initiative, that when this pandemic started, I was in Washington, D.C., talking about the great strides our community has made in early childhood, speaking on a panel. That's what that is. You invest in little ones, and you invest in them early so they stay on grade, and you're passing your 4th grade proficiency exams, and you're kindergarten ready, and then you get these kids through high school, then they're making good choices with their lives. So we do that, and we have been doing that, and we'll continue to do that. We have to get through a budget gap that's been driven by a pandemic now. So I'm curious to see if someone ever puts anything on paper with that. I don't think it's not an either or, funding people or defunding police. You need your police departments, period. And so you need to invest in people, period. So you have to do both, and you have to be strong in doing both. Other questions? Mm-hmm. Yeah, so we've been doing contact tracing for decades in health departments. We were doing it before this program. We actually were a pilot county with this program, and Dr. Gupta and her team have been pro bono consultants on this rollout and helping, and they continue to help state DOH with this program. It's important that when you look at federal funding for the state of New York and local governments related to contact tracing, that we all work from this system. They're like any brand new system, implemented in a short period of time, you'll find hiccups and ways for it to improve. We had a very good conversation with Larry Schwartz, who's helped the governor's team run this. He's asking for our feedback. How can we make this better? We had that conversation today. So you're going to have hiccups, and like anything, you work them out. But in Onondaga County, we were pretty instrumental in helping get this off the ground and consistently giving feedback. I have seen the reports where other counties have not had this, pleasant experiences. I can't really speak to those specifically. As long as each of these counties are getting their job done and making sure that they're quickly isolating these folks and quarantining the right people, I guess it's no harm, no foul, but you get paid if you're not participating in it. So I think there's, we always take the approach, let's figure out a way to get to yes. That I say that all the time. Figure out a way where you're comfortable using this system is probably a good thing to do as well. There's federal aid available for states and local governments related to COVID expenses. So certainly this program is a COVID expense. Yes, so potentially some of our contact tracers, we could potentially get some reimbursement for that. So that's valuable to us. For us, we haven't, again, we are more engaged in the process because we were a pilot county on this, and we helped. So I haven't heard lots of specific issues with it. We don't have outside tracers for the most part from other parts of the community outside of our own tracers doing tracing work. So that's good. So it's our people doing the tracing work. I think in maybe some other counties that might be more of a blend where you have folks that aren't your own employees doing some tracing work. And I can see where that could run into challenges. Any other questions? Okay. Well, again, thank you, everybody. We will see everybody on Friday. Certainly, some good news related to where we're going with this, the data and the virus. We've been knocked around, and we've certainly lost too many people, but we're resilient and we're making progress. So I'll see you guys all Friday, and please enjoy the rest of the week. Thank you.